and welcome back to Healthy Living. Tonight we're talking about Colorectal Cancer Awareness Month, which is coming up this March. I'm here with Rose Greeno and Charlie LeBron. So for people who don't know, what is colorectal cancer?
Well, colorectal cancer is the cancer in the colon and in the rectum. So, in your intestine, we have a small and a large intestine. The colon is in the large intestine. The rectal is the last portion, the small portions on your intestine that connect it to your anus, when the poo comes out, for the layman terms,
So I understand the Cancer Coalition is really focusing on this type of cancer this year. Can you tell me, is it something that's common here in Guam?
Yes.
Yes, unfortunately, Guam's screening rates and Guam's cancer rates are really high considering we're such a small island. And for colon cancer, it is actually the number 3 death for men on island and number 4 for women.
And then to add, this is also the 3rd leading cause of cancer deaths in the U.S. So it's out there. Yeah.
So for people who aren't familiar with this, what are the risk factors? Do you know what causes this type of cancer?
Oh, as any type of cancers, the cause of this is really poor diet, and then lack of exercise, decreased activities, smoking is also, and there's some other factors that you got it to hereditary. If you have a family hereditary that have a cancer, those are the things also to consider.
Okay, so say it is hereditary, or you feel like maybe you have some of the risk factors. How would you get screened for this type of cancer?
Oh yeah, there's different kind of screening. So best thing is to go there and check with your primary care providers. That's why we're all having this campaign. So you can do for colonoscopy, they check your colon. And then we also have flex sigmoidoscopy, but those kind of, it's just a small, the lower portion of your colon that they check, and you do an in-office procedure. That's not much has been done right now. And then the other thing is the fecal occult blood. So, there's a kit, the doctors will give it to you, you bring it home, you put a sample of your poo over there, and they will look for some type of bleeding. So, because the bleeding is caused by the polyps. Usually cancer starts with the polyps in your colon. So that's what we're looking into.
Okay, so like many cancers, how would this be treated? Would it be with chemotherapy?
Well, it depends on the stages of your cancer. If your cancer is in the local stage, meaning it's not spread yet, it can be done treatment by surgery and then followed by chemotherapy. And those treatment is really all available in Guam. Yeah.
That's good, especially if it's such a, leading cause of death here on island. So I understand you guys are hosting an educational conference next month. Can you tell us a little bit about that?
Yeah. So on March 6th, we're going to have a colorectal cancer education conference. So Charlie and I is one of the speakers, and Dr. Yvette Polino, and really talk about system strengthening. So Dr. Polino is going to talk about cancer numbers in Guam, which we do have now. I talk about the guidelines and toolkit and to do screenings and the office practice. So Charlie's going to talk about.
I'm actually going to talk about community collaborations and the reasoning why it actually takes a lot of organization of companies, team leaders, NPOs, businesses, and these providers to come together to put something like this together. And the importance of this is actually the first for Guam, to have a colorectal education conference. Yes. We're also going to have a proclamation signing, which will be the first for Guam as well. And the reasoning for this is because we really need to make some form of impact and educate the community about colorectal cancer. It's almost in the same light as everybody knows about the Get Your Pink On, or that pink is representing a breast cancer, and everybody knows that October is Breast Cancer Awareness Month. In the same light, this is something that we need to bring to the public, that there are also other cancers that are very prevalent on island, and we need to take a stand now. In colorectal cancer, one of the biggest important thing to take from this is that it's preventable.
Yes.
And these are things, and it's preventable through screening. When Rose had mentioned family history, for you to understand your family history and for you to inform your physician about it, it's you taking a proactive approach in your health. And when that happens, you actually may be screened earlier. These are tools and education that we want to let people know so that they can take a stand against cancer. They can join us in this kind of forum or a town hall or wherever there's information about cancer. Come to it, learn from it, and then take it home, and then involve your family in it, and then just be very proactive about it.
And the survival is way much significant increase if you detected it at early stage. Very, very. And even study shows 90% of survival for 5 years if detected at
an earlier stage.
At earlier stage.
Yeah.
But we still have two speakers.
Yes, and then following that is Dr. Saad from the Hafa Day Specialist Group. He's actually going to be talking about colorectal cancer screening. So it's wonderful that we actually have a surgeon involved in this as well. And then the last but not least, we're bringing in Dr. Don Dizon, and he's from the Massachusetts General Hospital Cancer Center, but he's actually a son of Guam. And he's going to be talking about cancer communication and patient engagement and advocacy. So if you notice, we have information. Here's the data on Guam. Here's system strengthening. Here's a collaborative effort. This is what a surgeon does. And this is what we need to do to talk to the patients as a medical profession. So it really ties in together to strengthen our fight.
Yeah, and let me add, as you mentioned about collaboration, and this one is, I really want to just mention, we could have done this big event conference without the help of the Take Care Insurance. Yeah, they're the one actually that provide us as the funds to put together this big conference.
Okay, so final thought for people who want to sign up or attend, how can they find out more information?
So this conference is geared toward healthcare professionals, so the nurses, doctors, medical assistants, LPNs, and other healthcare team to sign up and call up Vivian Pareja at Public Health at 735-0670. And of course, thank you KUM for having us this evening.
All right, well, thank you so much, ladies. Stay tuned. Up next, we'll take